turn off your video to minimize background noise for the presenters. Post questions in the chat area at any time. We'll try to respond to those that we can during the presentation as we go along, and then we do have 10 minutes reserved for Q&A at the end of the session. The webinar is being recorded and it will be made available to everyone who registered and also available on the website. So for people who weren't able to join, they should be able to have access to it. Okay, so my name is Roxanne Kairos. I'm a research scientist at NYU Global Ties. And for those of you who were able to join us for the last webinar, I was able to facilitate them as well, and I'm very excited to do so today. We are hearing from 3 presenters on a set of measurement tools today, and we do have the 10 minutes reserved at the end, so we're looking forward to being able to discuss a little bit more at that time. For those of you who joined us in November for the launch of the library, welcome back. And for those of you who weren't able to join, we do have that webinar recorded as well. So if you're interested in hearing more about what went into the development and vetting of tools for the library, or would like a more in-depth overview of the measures that we covered then, which were the Early Childhood Behavior Questionnaire, the International Social and Emotional Learning Assessment, the Academic Readiness of Children Measure, the Student Learning in Emergency Checklist, as well as the Measurement Guidance Resource that is available on the recorded webinar from November. And as we've mentioned before, the Measurement Library is a living resource. So we aim to continue adding measures with high quality evidence of how well they were functioning in the context in which they were tested. And we'll continue to host these types of webinars as we add additional measures to the library. Today, we have the pleasure of hearing from Dr. Hyeon Kim on a measure called SERAIS to assess social and emotional learning. And then we'll hear from Dr. Fiona McEwen on a set of mental health measures. And then at the end, we'll hear from Autumn Brown on 2 measures to assess program implementation. Before we hear from them, though, I wanted to highlight a few key features of the library for those of you who haven't had a chance to use it or who have and maybe aren't aware of these features. So when you scroll down from the home page, you'll see 2 options of how to kind of select measures on the library. The first is a quiz, and the quiz will ask you 2 questions. One is about the purpose of measurement, and the second is about what it is you're trying to measure. So what you can do is click through those options, and then it will present you with a set of measures that kind of meet those criteria. The second way to identify measures is to use the filtering, which are what's identified on the bottom of the slide here. So you can select what the purpose is, what type of information you're trying to collect, what language it's available in, and the age group that the measure was tested in. And then it'll produce a set of measures that meet those criteria. And finally, if you just want to see what's available, you can scroll all the way to the bottom of the page, and all of the measures that are included in the library are listed there. I believe we have a total of 13 resources available right now. So you can just click through and see what's available there. Once you click onto one of the measures, you end up on a measure landing page. And this is what the measure landing page looks like. So at the top left, you have some information about those kind of selection criteria that I discussed on the last slide. So the use, the resource category identifies the type of outcomes that the measure is meant to assess, and then the age group that it was tested when is listed there. In the header, there's 3 links. There's the MENAT measurement library link, which will help you get back to the home page of the measurement library. The second is the measure review criteria, which if you see these little tree icons that are on the page, the measure review criteria gives some information about how we made the recommendation for what level the evidence shows the measurement tool is good for use at. And then the final link that's in that header there is a measure guidance document. And that is really helpful in helping you think about how to select a measure and then the adaptation process of that. At the bottom of the page, you'll see zip files, which is where all of the materials related to the measurement tool are included for all measures that are either ready for purpose or proceed for purpose with caution and revisions. The measurement tool itself will be available in those zip files. For measures that are under development, we ask that you contact the developer of the measurement tool if you'd like to use that tool, so they can give you a little bit more information about why it was categorized as under development. So that's just a quick overview of what's available on the website and how things are organized. And now I will hand it over to Dr. Hyun Kim, who is also from NYU Global Ties, and she will be presenting on the social emotional response and information scenarios tool, which was adapted and tested in partnership with the International Rescue Committee. Hyun, I'll hand it over to you.
Hello, everyone. Thank you for calling in. Today, I'm going to present a measure called SERAIS. Roxanne just introduced me. It's called Social Emotional Responses and Information Scenarios. And the SERAIS also, it means in French, I would. That makes a lot of sense as a name because it asks children about what they would do in a certain social situation. As a whole, SERAIS is a measure of children's ability to deal with social conflict situation. When a child faces a conflict, their response to the situation would be based on the combination of what they think of the situation, how they would feel about it, and how they would behave as a response. Also important to keep in mind, these cognitive, social, and emotional skills are not a standalone general skills. Children would behave and think in any situation. These are the children's response to specific social situations. So for example, can we go back a little bit? For example, when a child is in a situation where someone cuts in a line, he or she is standing to get a pencil from a teacher. The child may think the person who cut in the line did it on purpose or just didn't see the child. He or she may feel angry about it or sad about it or not. And depending on what they think and feel, they would decide whether to react aggressively or to resolve the situation in a more positive way by talking to them and so on. Next page. Specifically, SERAIS is designed for program evaluation and basic research purposes to capture 4 aspects of children's social emotional skills related to conflict resolution. So the first element is hostile attribution bias. This is a cognitive tendency of the child to interpret others' behavior in a social situation as hostile. The second construct that we are measuring is emotion orientation. It's types and intensity of the emotions the child may experience in a socially challenging situations, such as feeling angry, sad, or calm. And the third element is emotional dysregulation. It represents the types and intensity of the emotions the child may express in such situation, whether they would express dysregulated emotions or not. And the last element is interpersonal negotiation strategies. These are the behaviors and responses that the child would display in such a conflict situation. So it could be aggressive behavior or disengagement from the situation, appealing to authority, talking to teachers, or other more social resolution-oriented strategies. Next page. So to capture these constructs, SERAIS presents a child, a social situation, as you see in the screen, that could potentially lead to a conflict. And we ask children a series of questions, for example, whether the child think that this happened, that the other child behaved this way on purpose or by accident, whether they would feel angry, sad, or calm, and also whether how they would behave in this situation, whether they would cry, ask the child why why they did this, and so on. And as a whole, it takes about 20 minutes because we have 6 scenarios and 13 questions for each of the scenarios. Next. So currently, this measure has been used and validated for Syrian refugee children in Lebanon, participating in the IRC's non-formal education programming. It has been used for program evaluation for the IRC's social emotional program that's implemented in 2017 to 18, and has shown sensitivity to program impact. In terms of the measure psychometric property, SERAIS have shown strong evidence of reliability with a robust internal consistency and high correlations across time for the same constructs. We also have strong evidence for validity, including consistent vector structure, high vector loadings, meaning the items are related to what we should be measuring. We also have an evidence of measurement invariance across time and different student groups, meaning we are measuring the same things for the children who are in different groups, boys and girls, or different treatment groups, and also across time from fall to spring. And lastly, we also have evidence showing the children's characteristics and their environmental risk factors and other social emotional skills are correlated with social emotional skills measured in SERAIS in expected directions. Given all the evidence, we are confident to say this measure is ready for use for the purposes of vigorous program evaluation and descriptive studies with the population this measure is validated with, which is Syrian refugee children in Lebanon attending Lebanese public schools. For future use of SERAIS, we highly recommend a careful adaptation and validation when it's to be used with a different population in different contexts. So a few things that I would recommend to pay special attention to is first, we advise carefully review the scenarios that we used and presented here for the measures and to consider revising both the scenarios and items that are dependent on the scenario to better align the measure with the target population's experience and social repertoire in their own culture, context, and age groups. We would also recommend the further piloting some of the measures, especially the emotion-related measures, items in Arabic and in other languages when translated, especially for anger and sadness related items, because these emotional languages can be misinterpreted in different cultural and linguistic backgrounds. We also advise considering revising a couple of disengagement items we have in the measurement library for the future iteration. Currently, a couple of items may have some negative tones to it and have a double-barreled wording. Revising those items may increase the validity and reliability of those items. In addition, revising the scenarios and items, I suggest take care to avoid any gender-sensitive terms and other cultural population stereotypes in adaptation, as they would likely to capture something that's not what the SERAIS meant to capture. And we also strongly advise against the use of this measure for screening or formative assessment purposes, as it is not developed or validated for such purposes, and it may actually lead to misinterpretation of the results and stigmatization of the children that they are subjected to. And lastly, this measure is very much under it's a work in progress. So please check back for any updates for further evidence and share if you have used these measures and with your sample with your children, please share the evidence with us so we can improve our measure and share with other people as well. Thank you so much.
Okay, thank you so much, Haiyan. If you have any questions for Haiyan, please enter them in the chat box and we'll try to get to those during the Q&A session. And I will now hand it over to, to Dr. Fiona McEwen from Queen Mary University of London, who worked in partnership with Médecins du Monde, the Institute for Development Research Advocacy and Applied Care, and the American University of Beirut to test actually a large set of measures for mental health. There are 6 total measures that have been added to the library, but today she'll be presenting on just 2 of those. So I will hand it over to Fiona now.
Thank you very much. So you've already sort of said a lot of what I was just about to say, is the fact that this is a collaboration between a number of institutes, and I'm based in London at Queen Mary University of London, but we worked closely with Médecins du Monde. They have extensive experience working with refugee populations in Lebanon, so they managed the field work, and then we've also worked very closely with Ellie Karam's team at IDRAC and with Tanya Bosky at the American University of Beirut. The next slide, please. So Syrians make up the majority of the estimated 1.5 million refugees in Lebanon, and in fact the numbers of refugees may be higher than that because many refugees are not registered. And we know that conflict-affected Syrians may experience and report a wide range of mental health symptoms, but it's really important to keep in mind that mental health symptoms, they might be relatively common, but they don't necessarily indicate mental disorders. And as an example, some of the children in our research have reported a range of fears that may be relatively normative in the context. So for example, children who are scared of snakes, but actually there are places where there are large snakes coming into tents. They may be fearful about army raids, they may be frequently checking for safety and so on. And while these can be symptoms of mental health disorders, in this context, they may be normative in some cases and perhaps even adaptive. So we need to keep that in mind. So what we're interested in is whether we can accurately identify those children who do have mental disorders so that we can identify children who might benefit from treatment. And also, if we want to estimate the prevalence of mental disorders, we need to be able to do that accurately so we can assess the possible need for mental health services in this population. And the gold standard would be to go out and do clinical interviews, but often those are too expensive or time consuming to be done on a large scale. So often people rely on brief screening tools in these sorts of contexts. And what we want to know is whether, what's the quality of the information we get from that? Can we identify children with mental disorders using screening tools? And do they work in this particular population? Because many of the measures have been developed in other populations, like in the US and the UK, but we need to know if the adapted and translated versions work in this particular population. So the aim of this study was to establish the reliability and validity of brief screening tools for common mental health problems in Syrian refugee children who are living in Lebanon. As you heard, we've looked at a range of different measures, but the ones I'll talk about today are a screening tool for depression, the Centre for Epidemiological Studies Depression Scale for Children of the CES-DC, and we used an abridged 10-item version, and also one for anxiety. So we used the Screen for Child Anxiety-Related Emotional Disorders, or the SPARED, and we used an abridged 18-item version. So if a translation wasn't available, we translated using a full forward and back translation protocol, and also including review by local experts. We did fairly extensive piloting with Syrian refugees, and we used that to amend the tools, and we paid a special attention to things like Arabic dialect. We collected data as part of a cohort study, the BioPath study, where we recruited and interviewed about 1,600 children and caregivers at baseline, and then about 1,000 of those families were followed up a year later. These were all Syrian children who were aged between 8 and 16 years at recruitment, who had left Syria due to the war in the past 4 years. And they were all living in informal tented settlements in the Bekaa region. It's important to bear that in mind. So that means we've looked at the tool's performance in this particular population of quite vulnerable refugees. It may not perform exactly the same way in different types of populations. We did further data collection in a subsample of 119 families, and that was to complete a clinical interview. And we used that to then to look at the validity of the measures. So the things we were interested in is the internal consistency, reliability of the scales. You really effectively do the items sort of hang together as a coherent scale. We did factor analysis, so where measures have got a subscale structure, and the SCARED has 4 different subscales in our version, we wanted to know whether the items fit that expected pattern. And then we looked at validity, so we wanted to know in our smaller sample with clinical interview data, do the screening tools correctly predict which children have mental disorder? And I should just note that we didn't have the data to look at either test, retest, or inter-rater reliability, so that's work that still needs to be done. So we completed the questionnaires as in interview format, and that's because of low literacy levels in this population. We didn't want to just hand people questionnaires and expect them to complete them. So everything was done as an interview. That was mostly done in person, but in a small number of cases, we used phone interviews as well. We use visual aids like the one you can see here with the water glasses. So many people struggle with sort of Likert scale response format where they're given multiple response options. But we found that people often find it easier if they have a visual aid like this, so that you sort of train them how to use at the beginning and then they use that for the different questionnaires. The data was entered directly into the online platform Qualtrics, and we use offline apps for that as well. You can see the photo at the bottom, the interviewer is directly entering the data into a tablet. We did a clinical interview. We used the mini kit, and that was completed either in the settlement or some families came into the clinic for that. And there was clinical supervision for all of these cases. So a consensus diagnosis was made, which was based on information from the mini kit, but also clinical judgment. And we assigned a clinical global impression severity score. So this takes into account the level of impairment and distress that the child experiences. So for someone to be defined as a case, they had to meet diagnostic criteria for that disorder and have significant impairment or distress associated with that. So the CES-DC, this is the screen for depression. So the factor analysis revealed 1 factor, which was what we expected for our 10-item scale. The Cronbach's alpha, that's a measure of internal consistency. We wanted that to be above 0.8, and it is, so that looks fine. The area under the curve relates to the ROC curve analysis, which is on the top right of the screen. What this is a way of plotting the sensitivity of the tool against the specificity, or 1 minus specificity. And what we're looking for is a tool that has both good sensitivity and good specificity at the same, 1 cutoff. The line on the diagonal is the line of chance performance. And what we're looking for is a curve that goes as close as possible to the top left-hand corner of that chart. What we have is a line that's a curve that's about halfway between that. It meets criteria for it to be considered acceptable, but it could be better than that. If you look at the figure on the bottom right, this is showing the questionnaire scores in 3 different groups of children. So the bar on the right-hand side is those children who meet criteria for depression, and the dashed line is the cutoff score on the scale of 10. So most children who have depression score above that cutoff, so we have good sensitivity. On the left-hand side, we have those children who have no evidence of depression or non-cases, and most of them score above cutoff, below cutoff. In the middle, we have a group who report some symptoms of depression but don't meet criteria, that they don't have significant impairment or distress associated with those symptoms. And what we see is that most of them score above cutoff as well. So this tool is not distinguishing very well between those children who clearly meet criteria for depression and those who have sort of subclinical, some symptoms but don't really meet criteria. And I suppose when you think about it in this context, these are children living in tents, living often in very challenging conditions. When you ask them questions about do they feel sort of down or a bit unhappy, it's understandable that many children will report that without meeting criteria for depression. On the next slide, I'm going to run through the sensitivity and specificity and so on. So here we have a whole lot of children who've been screened with the CES-DC. We have some who are below cutoff, who are screen negative, and some who screen positive or above cutoff. On the next slide, we see we interview information from the clinical interviews. So we have those who meet criteria for depression and those who don't. On the next slide, we see that the sensitivity is 81%. So that means that most of those who have depression score above cutoff. So the tool sort of captures most of those who have got depression. On the next slide, we see the specificity. So of those who don't have depression, about half of them are correctly classified, but that means about half aren't. So the specificity is not as good. On the next slide, we look at the positive predictive value. So this is where we take those who scored above cutoff, those who screen positive, and we look at how many of them actually have depression. And about a third of them do. What that means is that there's quite a large number of false positives if you use this tool at this cutoff. And then on the next slide, we see the negative predictive value. So this is those who screened negative, and the majority of them indeed don't have depression, and we have a relatively small number of false negatives. So that means you can be much more confident in a negative result. A negative result is much better at ruling out depression, whereas a positive result, we know there are a lot of false positives there as well. So on the next slide, we're then going to talk about the scared. So the exploratory factor analysis revealed 4 factors, and there are 4 subscales in this scale, so the factors didn't completely map onto that, and there are some items that seem to not quite work, so we have to look more at that. The Cronbach's alpha, the internal consistency is fairly good, so that's fine. The ROC curve shows that the area under the curve is just below the criteria that's normally considered acceptable. And if you look at the figure on the bottom right, you can see why that is, that many of probably the majority of the non-cases, children who have no evidence of anxiety disorder on clinical interview, many of them score above cutoff on this tool as well. So on the next slide, we just want to sort of think about what might explain the relatively poor performance of our abridged version of the scared in this population. And there's many of the items were endorsed at very high frequency, and we're sort of wondering if some of those are confounded by aspects of culture or the context of displacement. In the chart on the bar chart on the bottom left is the response sort of pattern for the item. I get really frightened for no reason at all. And this is what we expect to see from measures like pathology. The majority of children say that's not true, they don't experience that, and then a relatively small number endorse that item. The bar chart on the right, I get scared if I sleep away from home. This is the pattern we saw for quite a lot of items, in that actually the majority of children said, yes, that's very true of me, or often true, and a smaller number don't endorse that item. So this is not what we expect to see for measures of psychopathology. And a number of items, like I'm afraid to be alone in the house, I worry about how well I do things, I feel shy with people I don't know well. A number of these items had this sort of response format. So we need to think more about why this seems to not be working. We have colleagues who have used this with Lebanese children who have had sort of similar concerns that it's maybe sort of, throwing up seemingly very high prevalence rates of anxiety. So we need to think more about why this particular scale doesn't seem to be working so well in this type of population. So just to recap, the CES-DC, it's possible to select a cutoff that achieves good sensitivity and therefore can identify most cases of children with depression. However, it results in relatively low specificity and a high number of false positives. And that means if it's used in a clinical context, for example, for screening into a service, you would need further assessment to determine which of those children really have depression and which are false positives. If we're using it to estimate prevalence, we have to bear in mind there's a significant proportion of false positives which will inflate prevalence estimates, and this may be true for many of these types of screening tools. We always have to bear that in mind, and that means we have to think about adjusting the cutoffs to try and balance the number of false positives and false negatives to get more accurate prevalence estimates. And also we saw that it was difficult to differentiate cases of depression from children who report some symptoms but don't have significant impairment. So the question is, that latter group are probably not children who need mental health services. Anecdotally, many children in the study would report things like feeling very sad because they didn't have access to school. So clearly, many of these cases, what we need to do is sort of sort out those other problems, and mental health services should be for those children who clearly meet criteria for disorders. With the scared, it didn't differentiate well between cases and non-cases, so we're not currently recommending its use in this particular population, and we need to do further work to try and establish tools that would work better. And just finally, I just want to remind, as a reminder, to sort of reiterate that it's really important to evaluate the reliability and validity of these types of tools in the population in which they're to be used, but also for the purpose and in the context in which it's to be used. So we selected a sample of children who are relatively representative of this population. So these are statistics that are relevant to a situation where you've screened a whole population. If you're going to use it in for example, a clinical context where you have not a mix of children with mental health problems and without, but actually a whole group of children who presented to mental health services because they have some types of problems, and you then want a tool that will help you differentiate between different types of problems, that's a different sort of use. So the statistics presented here will not reflect its use in that sort of context and for that use. So we'll need to do further work to look at its use in these different types of contexts. So just finally, just thank you. And this is just a reminder that the work is the result of a collaboration between a whole lot of people, a whole lot of institutions. Thank you.
Thank you so much, Fiona. And for those of you who haven't had a chance to add your questions to the chat yet for Fiona, please do so, and we'll try to cover those during the Q&A. And last but not least, I will hand it over to Autumn Brown from the International Rescue Committee, who will be talking a bit about two measures for implementation and quality assessment. So I'll pass it over to you, Autumn.
Hi, everyone. This is Autumn. You'll have to forgive me for not putting my video on. I'm actually traveling right now, and I've been having problems with my internet connection, which is also the reason why this presentation is hopefully like a good PIQ measure, short, simple, but effective. And yeah, everyone's muted, but I'm going to assume you're laughing at all of my jokes. I'm going to jump right in. The PIQ measurement is part of our effort for improving measurement in education emergencies has been working to develop measures of implementation quality. The foundation of this effort really has been the understanding that high quality measures of fidelity, dosage, and quality are equally important as measures of holistic learning if we want to answer not only if an intervention is effective, but really how. For us, deciding which kind of program implementation quality measures to focus on was a multi-step process, but really deciding kind of which pathways we thought were the most crucial to understand in order to better understand our outcomes, and also which ones were just most urgently needed for continuous improvement of our programming. So we chose to focus specifically on three measures: attendance, the teacher classroom observation, which I won't be talking about today, but in a future webinar, I hope to be able to talk about our work with that. And also the physical environment of the classroom, which we've been measuring via a spot check form is what we've been calling it. I'm going to talk first about Classbook. You can see a couple screenshots here, but I'm just going to talk a bit through what you can expect with Classbook. Classbook is an Android application that we've been developing that enables teachers to not only collect attendance data, but actually visualize it and use it. I feel like most practitioners will understand when I talk about like the agonies of trying to collect and use attendance data on an ongoing basis, especially when it comes to individual level student attendance. Oftentimes it can take weeks for attendance to leave the classroom, make it into a database, and be visualized for use to the point where it's hardly actionable anymore. So it's been a huge priority for us to try and come up with a solution on how to collect and use attendance data quickly so that we can really do whatever we can to ensure that children are able to participate in the education services. So we had developed this Android application in remedial classrooms in Lebanon. So that's an important kind of piece of information, is that this was designed specifically for that context. We have been testing it in additional contexts, but it hasn't we haven't yet adapted it across several contexts. But the application links to an Excel database where it uploads all the student registered information. We're also adding in features where you can register students within the application. And then for each classroom, teachers can access their registrar and take attendance. And then attendance is visualized, teachers can filter it, and they can also access kind of the student profile information in the application. There's also features in the application where M&E staff and officers, coaches, those kind of helping also improve the attendance, doing community outreach, can access the application and also see the aggregated data and export reports directly from the application into Excel for donor reporting purposes. Currently, the application is available on the Google Play Store under Classbook. We've been working in collaboration with USTOD Mobile. You will need an admin permission to access it at this point, but for anyone who's interested in downloading it and testing it or looking through it, whatever it is, I hope you feel free to talk to me, and I can be more than happy to walk you through that process. But next week, this will be available in the library with guidance on how to do that. The testing and the software development process is continuous, but the code, everything is open source, including the code for those who, I know there's additional or similar initiatives that are also building applications. And I'm hopeful that the work we did with a human-centered designer to design the application to be extremely user-friendly can benefit others who are also working on building attendance-taking applications. I will move on to spot check. We have across the IRC several different instruments that are used to assess the physical safety of the classroom, as well as just the environment, whether or not the environment is conducive to learning. But it was important for us to go through a user-centered design process to build a tool that would produce reliable data. So we worked with a human-centered designer, we worked with the team in Lebanon to take what they were currently using, map the different pieces of data across donors, look at international standards, the INE standards on safety in classrooms, and build out this very user-friendly instrument that allows for the assessment of the physical environment of the classroom. This will also be available on the website, in the library, and along with it, guidance on how to use the data. I'm including guidance on the indicators that we calculate using this data, in hopes that others can also find it useful. But again, please let me know if you have any questions. Oh, I forgot to mention, both of these come with training materials. So Classbook has a user manual attached to it that has training videos. And SpotCheck has a series of PowerPoints and an instructional one-pager for M&E staff to use when they want to train data collectors or coaches or whoever's collecting the data on how to use it. So hopefully everything that one might need to start using these instruments will be available. But again, I'd be really excited to hear others' experiences with these tools. Yep, thank you.
Okay, thank you so much, Autumn, for sharing about those. And if there are some additional questions for Autumn, please keep them coming, or for anyone else, or about the library in general, please do feel free to add those into the chat box. I think it will be most easiest for us to respond to those if you can type them up and share them with us. And as you're doing that, I will start posing some of the questions that were asked earlier to the three presenters so that we can get started on the Q&A session. So for Hayan, I'm gonna start with two questions because I think one is fairly easy. The first is, will the SERAIS be available in Spanish? And then the second is, these are both kind of clarification questions. The second is, this is apparently being validated with children in formal schools. What are thoughts about engaging with children not in formal schools?
Thank you for the questions. For SERAIS, currently it's available in Arabic, English, and French. We also use this tool in Niger, but unfortunately we don't have the Spanish translated at the moment. I would be excited to participate in any adaptation of this measure in any other context in different languages. So if you are interested in using this measure in different contexts, in different languages, please keep in touch with us so we can support adaptation effort, and we could potentially collaborate on this measure. And in terms of use with the children who are in who are not in the formal school settings, it depends on the population that you are working with. It's really, so the validation has been done with the children who are in non-formal school settings, but who also attends the public school. So it is applicable for the children who are in non-formal education settings, but further validation needs to be happening in order to confirm the validity of this measure for the population. For the children who are not in educational settings, a lot of the items and also the scenarios are developed with an assumption that the children are in classroom settings and school settings. So those scenarios and items need to be adapted in order to accommodate those children who are not in educational settings.
Thank you, Hyan. And I have a question for Fiona that I think you partially answered in your presentation, but if you could add a little bit more to it. There was a question about the relationship between mourning and depression, and how can, if there's a way to measure mourning as compared to depression. I don't know if you can speak a little bit more to kind of the thinking that's happened with the results of these measures.
Yeah, absolutely. I mean, I think using screening tools, this is one of the major problems, is that you don't have that context. If you do a full clinical interview, obviously you have a lot more information, and then you can come to more of a conclusion about those things. But it's just a sort of, I suppose, a caveat about using screening tools is that you don't have that context. You will include children who are mourning or who have other sort of stressors that means that they have some symptoms of mental health problems without necessarily meeting clinical criteria for a disorder. So any research findings that are based on sort of using questionnaire methodology, we always need to bear that in mind, that it will be no doubt sort of throwing up false positives. So we do need to think how better to address these. So as I said, in clinical context, you can do a second stage of assessment where you sort of do something that's more in-depth. So you might just want to use a tool for screening into a service and then do more sort of in-depth assessment at that stage. But you do need to take care of these things, definitely.
Okay, thank you. And a few questions for Autumn. So I think they're fairly simple questions, so I'll go through a few of them. The first question is, who owns and has access to the data put into the Classbook app? And the second is the app in different languages? Can it be adapted to various contexts?
Yes, so the application automatically is in the language of your phone, the same technology that Android uses to translate everything in your phone into a specific language is used in Classbook. So whatever language the phone is in is also the application. In terms of who owns the data, currently all the data is being hosted on USTOD servers. As it grows, that may be changing, but the data will always be, your data, even if it's hosted on USTOD server. Should I just go through, Roxanne, to the other questions?
Sure. I think that there's some questions about adapting this to various contexts. And if it's something that can just be, that is just for the IRC, or can be used by other people?
Yes, so the scope of the first phase of this development was really focused on the IRC's remedial program here in Lebanon. But we have been testing it in northern Nigeria, for example, and adapting it so that it can fit across not only more context, but more varied types of programming. Like any application, there's new versions coming out all the time, and every version is taking into consideration what we've learned in terms of making it as broadly applicable across contexts as possible. Part of that is making it really easy for the user to, within the application, set parameters like class hours, what are the holidays, like things like that you need to be able to track attendance over time.
Mm-hmm. And then there's another question about whether or not additional SEL-focused questions can be attached or integrated, or I imagine kind of any additional questions.
We don't have, for the attendance, so the application actually has several features that we're testing out, but currently the feature that we're going to be putting on the library is just attendance taking. So there's not like the survey kind of capabilities for asking SEL types of questions. It's really just an attendance taking application. But we are testing additional features, so stay tuned.
Okay, and then what are average class sizes it has been used with to date? How easy is it to use with larger class sizes, which are often the case in humanitarian settings?
Excellent question. So far, our remedial programming have class sizes of 20 students, so it's not necessarily representative of all class sizes in humanitarian settings. I would love for someone to test it in larger class sizes and see what we can do to create a version that takes that into consideration.
Great. And then you touched on this a little bit, but there's also a question about how data is collected, analyzed, and acted upon.
The data is, it depends on that depends on the user. I would say for teachers, who is the central user of the application, the data is collected. There's like a feed page. It's called Classbook because it was kind of a joke in Lebanon that it was like the Facebook for classes, because there is like a feed page that the teacher receives, where it'll have things like, oh, take attendance today, or here was your average attendance over the last month, etc. And then they click on take attendance today and for this class, and then that classroom's registrar comes up. It has absent, present, and then we ended up adding a button actually for partially present because it was a feature that was in demand for teachers just in case, students arrive really late or leave really early. And then if the it all works offline, but once the application connects, the data syncs, and there is another screen that shows a run chart of attendance data over time. And then it also has a screen where it shows the list of the students and their attendance, where you can filter it on different, like lowest to highest attending. You can put in different kind of attendance windows. So like, show me all the students who've attended less than 70% of the time over the last month, for example. And then the teacher can use that to see which students are attending, not attending. And also with the permissions given, coaches or head teachers or IRC staff can look at that same data. But one of the next steps is we do want to build out more guidance for teachers on like, okay, when a student falls into the red or whatever the parameter is, what is the exact action for that? Yeah, sorry, that was kind of a long answer, but.
No, that's great. I have one more question for you, and then I'm going to jump back actually to a question for Hayan. The next question is if there are any child protection concerns regarding the confidentiality of the data collected.
The data, so everyone is given permissions. So there's one central administrator who's normally like an M&E manager, coordinator in the country. And then permissions are given where a teacher can only see the attendance for their classes in their classrooms. and a principal or head teacher can only see it for the teachers that they manage. So I feel like in terms of the risks for confidentiality, it's the same as paper-based because of the permissions that we're giving.
Okay, thank you. And there's a couple of questions for Hayan. One was, can the child choose other answers in the list that you showed in the slide? For this question, I would actually recommend that whoever was asking this take a look at the measure itself on the library and kind of see what the options are available there. I think that'll probably be the easiest way to get an answer to that question. The second is a two-part question. The first being, to what extent have you engaged with the Ministry of Education in the countries to be part of the research? And the second part is, have you had any strategy to sustain this given the efforts made, given the dynamic nature of education in emergency settings?
For the first question, we have not had a chance to actually engage in the measure development of the SERAIS with the Ministry of Education. We did get an approval for the study, but in the future, we are Global Ties and is actually actively collaborating with the Ministry of Education in many aspects, including the social emotional learning framework and measurement. So we are expecting more collaboration with the government for the measures of social emotional learning. For the second question, Roxanne, do you mind rephrasing?
Sure.
Yeah.
Yeah, and whoever asked this question, if you can chime in as well. The reading of the question is, have you had any strategy to sustain this given the efforts made, given the dynamic nature of education in emergency settings? So I think continuing doing this type of research is the way that I'm reading the question.
Yeah, in terms of the education programming that we are running, we definitely made every effort to continue the programming, and also for this particular program, it was the second year of doing the research. I do agree that it is really essential to continue the sustained effort for the research, both research and programming, with the same group of students and same context, in order to really understand and support these children's learning and social emotional growth. In terms of the possibility of sustainability without the absence of humanitarian support, that will absolutely require constant and consistent collaboration with the government and local communities.
All right, thank you so much, Hayan. I think since we're getting really close to the end of the hour here, there are a few additional questions on Classbook, which you're welcome to get in touch with Autumn directly on those. I do think that we'll be sending out responses to any additional questions that we weren't able to get to. I am going to invite my colleague Carly to chime in if there's anything that I missed, but I do want to say that the measurement library, as I mentioned before, is a living resource that we would like to continue building upon, which means that we're also very much open to all of you contributing evidence on measurement tools that you've used in various contexts so that we can add those into the library. Right now, the focus is on the Middle East, North Africa, and Turkey, but we're very open to building that out to be more of a global resource. So please do share those with us. And if you use any of the measurement tools that are on the library, we highly encourage you to share back the information, especially with the developer, on what you've been finding so far, so that we can build that evidence base and see if there's evidence of validity and reliability for other purposes or in other contexts with different populations. It will just make the resource all the more valuable for everyone using it. Once you have a chance to use the library, please do give us feedback if there's things that you think should be added, things that aren't working quite well for you. It's a growing process, so we're very happy to get your feedback on the resources that are there. And do know that we will keep adding to it. So there may not be measurement tools available right now for what you specifically want, but we do hope to keep adding. So keep checking back if you're not able to find what you're looking for the first time that you look. Carly or Jane, is there anything else that I missed that you'd like to add?
Thank you so much to all of the presenters, but only that there is also, as part of the resources available on the website, an inventory of measures, and so which is an Excel spreadsheet where we've worked to identify measures of children's holistic learning and development that have been used in the Middle East, North Africa, and Turkey. And so if you're looking on the Measurement Library website and you're not finding what you're looking for, do check out the that Excel sheet, as that can at least point you in the right direction. And that Excel spreadsheet is also something we will be adding to over the coming months. And so at least it will give you sort of a direction to go in to find additional information.
Just to chime in on that, there's currently 10 measures that are in the inventory. Once we update it, there should be about 100 measures on there. We're just working to make sure that it's in the best shape possible before we upload it. All right, so I think with that, we can probably sign off. If you have additional questions, please share them with us and we'll try to respond offline to those questions. And the webinar will be available as a link, so that will be sent out to you if there's any colleagues that you'd like to share it with. Thank you all so much for joining us.